first thing that patients have to realize is that basically in almost any area of the body, the radiation is just as effective as the surgery. So you have to look at your risks and benefits of each one. And really it should be, anybody who gets a skin cancer, they should get the choice to see both a radiation oncologist and a surgeon so they can make an informed decision. Often they don't, and they just go straight to the surgeon. The fact is, if it's on the face, we tend to get a better cosmetic result. And remember, the surgeons will often find abnormalities which they have to go beyond when they're cutting, even if it's not something that clinically is a problem. It's very hard under the microscope to know what to do, and it may be that it will never develop into a problem for the patient, but they still have to cut. So often they have a much bigger scar/deficit, and they need to have grafting. And for the radiation therapy, we give good margins beyond where we see clinical disease, and usually it's not an issue. And obviously you can have recurrences at the edge of the radiation field just like you can at the end of a Mohs surgery field. The fact is, on the face, we tend to get a better cosmetic result. On the ears, where you have cartilage that often has to be cut out if you have surgery, we tend to have a better cosmetic result. Now, in terms of going below the knees, as patients get older, the vascular supply is not as good, and especially in those patients, if they have any lesions below the knees, they'll often have some difficulty healing after the surgery. Not to say that they won't have as good healing after radiation as they would if they were 20 years younger, but usually the radiation can get you a cure without having nearly as much risk of healing problems that the surgery would have. The other place where radiation really can be very useful is the back of the hand, where the skin can be very thin, and on the scalp. There, if it's hard to do surgery and to close the wounds because of the thin skin. So those are areas that tend to be favored areas. That does not mean that areas on the back or anywhere on the thorax or even the upper arms can't be good radiation cases. But there, often the cosmetics is not as important, and if it's a small lesion, you might want to just cut it out. If it's a large lesion, if it's aggressive, you might want to do the radiation, especially in patients who are not good surgical candidates.
Is there a time when you can't do radiation and you must do surgery?
That is a really good question. I would say, if a lesion is just way too big and it looks like it's really invasive and deep, that you want to get results right away to get this out of the way. Like if you've got a lesion that's invading into the orbit by the eye, and you can't, if you think you could do surgery, that would be fine. Radiation, obviously you have to have CAT scans and maybe MRIs and do a lot of planning, but you're near the eye, and if you can do the surgery, get it out and save the eye, in that type of case, I would say maybe that would go with surgery first.
What do you say to people who say, oh, I'm just going to do the surgery because it's over and done with, and with radiation it takes maybe 10 treatments or 12 treatments, and this way I'm done and over with?
Yeah, that's really an American mentality. People want to just get things over with, but the fact is that the surgery can take hours. You often need to have grafting coming back for hours. When you add up all the time, it might be similar to the amount of time for the radiation, and especially when we come to the patient, they don't have to worry about transportation issues. It's something that really should be considered. But I understand that mentality, just get it over with. But the main thing I want to always emphasize to the patients is the surgeons will often tell you it's all out. But even though it looks like it's all out, it can come back. So you still have to, you don't have a guarantee with anything. You still have to be on top of things. And I've had patients who've had the surgery, and they said to me, I just want to get over it. Then they came to me for the radiation afterwards because they didn't like the cosmetics. They didn't realize that the surgery was so encompassing.